Now let's talk about health matters. A committee on a mission to evaluate cancer care and treatment has identified gaps to help determine future strategy and steps to be taken by the federal government. The Impact Review Committee, made up of both local and international experts, believe that if these critical gaps are addressed, Nigeria will be on the verge of reducing not only the burden of cancer, but also death from the disease.
In an effort to improve general cancer care in Nigeria, the Impact Review Committee was set up to ensure that the gaps and challenges affecting efficient cancer care in the country are reviewed and solutions given. This review committee, made up of both local and international experts, have toured cancer centers and infrastructure in Nigeria in the last 2 weeks. They are now here to present their findings in an exit report to the Minister of State for Health.
Collection and selection of experts here attest to the fact that you've really come in to do this gap and need analysis for us, and I can promise you the report that you're going to submit, you're going to be submitting, will be well used. We will utilize it because we have the political will.
Continuing around the whole country, the 6 regions of the country, to assess the capacity of all these cadres of healthcare delivery services in the area of cancer prevention.
The team visited teaching hospitals, general hospitals, a private cancer center, diagnostic center, primary healthcare centers, and had town hall meetings when they went outside of Abuja to the various regions. And with all of that, there will be a rich amount of data that was collected.
In 2018, Nigeria recorded more than 115,000 cancer cases and more than 70,000 deaths. The committee says it has assessed the readiness of the country to fight cancer, both in terms of human resources and infrastructure.
This impact review is meant to be a national level in scope, so this was particularly important. I would like to commend the government of Nigeria for the strong political will that we have seen time and again across all of these activities for engaging in and strengthening cancer control. We see that there are still some needs to cover the out-of-pocket costs for patients that, as we know, with cancer can be very high.
Experts here believe that the review has helped to give a proper evaluation of the cancer burden, how to improve prevention, diagnosis, treatment, and palliative care. Kemi Balogun, TVC News, Abu.
Cuba and Nigeria are pledged to strengthen economic relations and continue to stand in solidarity with one another. This was highlighted at the commemoration of the 50th anniversary of the bilateral relations between Cuba and Nigeria.
Cuba and Nigeria have maintained a cordial bilateral relation since July 1974. Cuba, at the commemoration of the 50th anniversary of the bilateral relations with Nigeria, appreciated the support Nigeria has always given to her. The ambassador says in advancing the ties, Cuba will increase commerce with Nigeria.
Unity, patriotic, rebellious, and resilience idiosyncrasy by tradition and religion belief. During those 50 years, we have worked on our bilateral relation not only to maintain but also inform and development the ties on many areas, and we also create an economic and commercial level. There has been an increase in the level of exchange during the last 2 years, expanding the possibility and opportunities for business and investment.
The spirit of cooperation and friendship definitely is what defines our national bilateral relation over the years. We reflect on our shared values, the journey we have made so far, the huge progress that we have gained throughout the years, and we must thank the Cuban government and people for the warm welcome for our students over the years. We have such a very strong alumni that have studied, especially in the field of medicine, over the years.
Cuba has been under sanction by the United States for about 64 years. At the recently held United Nations General Assembly, the president of Brazil spoke about U.S. reconsidering the sanction as it has greatly impacted on the development of the Spanish-speaking country. Ambassador Miriam Palmero says Cuba has survived only because of its resilience.
Cuba today, we suffer the very strong sanction against the U.S. for more than 64 years. But we are resilient, we are alive, and we continue because the Cuba continue starting with Fidel, with Raúl, with the Diaz-Canel, and all our heroes inside in Cuba and outside also they support us.
Cuba is in collaboration with NAFDAC for the development of vaccines.